Thank you for joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're joined today by London Mayor Ed Holder, the Medical Officer of Health for the Middlesex-London Health Unit, Dr. Alex Summers, and the Chief Medical Officer for London Health Sciences, Dr. Adam Dukelow. We'd like to welcome the media who are in attendance for this afternoon's briefing and invite them to submit their questions using the question forum here on Microsoft Teams. We'd also like to welcome those tuning in this afternoon on Rogers Television, Rogers Facebook page and YouTube channel, as well as those watching on the CTV London website. We'll get to the opening statements right away, and we'll start with London Mayor Ed Holder. Mayor Holder.
Well, thanks, Beth, and good afternoon, everyone. It's good to be back after a bit of time away and happy to report that no incidents of note over the weekend where COVID is concerned occurred as we fully transition into what I would call a new phase of this pandemic. So depending on where you are and what you're doing, you'll have noticed in some settings more people than not continue to wear masks, while in other settings, masks appear few and far between. And the comfort level, depending on your own circumstance or situation, is understandable. And I suspect it'll remain that way for some time yet in terms of the fluidity of how people deal with this. Because look, everyone is doing the best they can, and they're acting in the best interests of their families. And I hope that we continue to act in the best interests of each other by respecting whatever choices other individuals make with respect to masking. Some may continue to wear them indefinitely. Others feel comfortable going without. But whatever choice is made at this stage, it is entirely yours to make. All we can ask is that people choose kindness, decency, and respect, particularly when it comes to not judging or ascribing various motives to choices being made by different individuals. By all accounts, we're off to a good start in that regard, at least generally speaking. Let's carry on in the same manner, and let's continue to encourage those who haven't yet to get their third shots. The same goes for first and second shots. The vaccines remain our best defense against the worst outcomes associated with COVID. I have a family member who has been in the islands and is looking to come back to Canada, couldn't come back because of COVID, did not believe in the vaccine, and is experiencing some challenges because they've not been vaccinated at all. And the other aspect of this is that when they come and do get into Canada, because Canada will not refuse them, they will still be required to have a negative COVID test and the Arrive can. And at the same time, they're going to have to undergo 2 weeks of staying at home. So I say that there are still good reasons for individuals to get their shots. And if we're to apply any influence or any extra pressure, I think that's where those efforts should be focused. Lastly, unrelated to COVID, but I'm going to use this pulpit to say, with regard to Ukraine, that we're more than a month into this brutal conflict. And I'd like to say once again, and without reservation, Slava Ukraini. I know that Londoners stand with the people of Ukraine. We support you, and we continue to support our Ukrainian neighbors. I've indicated clearly and time and again that London will do whatever it can to help support people who come to this country as refugees. They're welcome to London, Ontario. I would add that I know they want to go home. So the likelihood of staying in Europe because of its proximity is likely greater, but they have a home in London, Ontario as long as they like. But in the meantime, we pray for peace and we pray for the safety of all brave men and women defending Ukraine at this very moment. Well, that's it for me. Over to you, Dr. Summers.
Thank you, Mayor Holder. Good afternoon, everyone. Thank you for joining us on this last bout of winter, we hope, here at the end of March. The Middlesex-London Health Unit is reporting an additional 56 COVID-19 cases today, with no additional COVID-19 case deaths. Over the weekend, there was 72 cases and no additional deaths reported on Sunday, 74 cases and no additional deaths reported on Saturday. This brings the total number of cases in the Middlesex-London region since the beginning of the pandemic to nearly 34,000. The number of COVID-19 related death remains at 358. With reopening and the gradual return of regular activities, we will see COVID-19 case counts rise. And we've seen early indications of that as we've seen the decline plateau and remain steady over the last number of weeks. Models from the COVID-19 science table do suggest that we will see a swell in cases and subsequent hospitalizations and ICU admissions through April and May. However, that swell will not be, if the projections are correct, as high, nearly as high as what was seen during the Omicron wave. However, I want to highlight that the risk of COVID-19 in the community remains high. Our objectives have always been to slow the transmission of COVID-19 through our population at this point, not to stop it. However, there are still things that you can do to reduce your risk as we see community transmission relatively rampant in our community. And that includes the familiar chorus of things: wear a mask, especially in indoor environments, but remain respectful of others, whether they choose to wear a mask or not. Highlighting on what Mayor Holder mentioned, may we bring decency, kindness, compassion, and empathy to all of our interactions, particularly as we try and navigate the ongoing risk of COVID-19 and each individual and group's individual assessment of the risk relative to them. Notably, make sure that you have been vaccinated against COVID-19 and get your booster. The booster continues to increase your protection against symptomatic illness, severe illness, and ICU admission. Fortunately, over 80% of those 65 and older have received a booster dose, but we'd love for that to be 100%. And of course, if you're over the age of 12, you are also eligible for a booster at any age. Therefore, get out and get boosted. It will protect you from getting sick against an illness that's not going to make you feel very good and may result in you going to hospital. Lastly, and important to remember this, that if you develop symptoms of COVID-19, stay at home. And I hope this is something that we can continue to do beyond the pandemic. If you've got a respiratory illness, you need to stay at home. And that's true for COVID-19, influenza, or even the common cold. As we return to those enjoyable, regular activities that we have postponed for so long, these types of precautions will help us mitigate against stressing out our healthcare system. So please take the protections that you can as we continue to try and weather this spring. With regards to vaccination, Superhero Saturday is coming again this Saturday, April 2nd. We are delighted that our region's superheroes will be joining us at our Western Fair Agriplex Mass Vaccination Clinic this Saturday, April 2nd, between 11 a.m. and 6 p.m. And we encourage children, families, anyone to dress up and join us for some superhero fun and a chance to meet some real superheroes who will be enjoying and spending the day with us at the Agriplex. On the vaccination file, I also want to highlight the public service announcement that was shared earlier last week, noting that as of March 29th, tomorrow, hours of operation at the Western Fair Agriplex will be moving to Tuesday to Saturday from 11 a.m. to 6 p.m. So again, the Agriplex Clinic will be open Tuesday to Saturday, 11 to 6. The clinic at Caradoc Community Center continues to run Monday to Wednesday from 11 to 6. All of our clinic schedules are available on our Health Unit website at healthunit.com. Appointments continue to be available for appointment as well as walk-in. And of course, we have ongoing mobile activities in our community as well. My last reminder is just around the Novavax COVID-19 vaccine that has been approved for use in Canada, and it will be available soon in the London and Middlesex region. The vaccine is available for those who have allergies to the mRNA vaccines or who are looking to receive a non-mRNA vaccine. And those mRNA vaccines are, of course, the Pfizer and Moderna vaccine that many of us have received. The Middlesex-London Health Unit will be receiving a supply of the Novavax vaccine this spring. So if you'd like to receive it, you can contact the Health Unit at our booking line at 226-289-3560. Again, that's 226-289-3560 to be added to the wait list. With that, I'm going to pass things over to Dr. Adam Dukelow from London Health Sciences Centre.
Thank you, Beth, Mayor Holder and Dr. Summers. I appreciate the opportunity to be here to update our community on the COVID-19 situation at London Health Sciences Centre. As of this morning, we're caring for 27 COVID-19 positive inpatients with 5 or fewer in critical care. Thankfully, in our children's hospital, there are no inpatients with COVID-19. We currently have 1 unit on outbreak, Our partners in infection control, as well as the unit team members, are working diligently to end this outbreak as soon as possible. In the past week, we have seen the number of staff testing positive rise. Because hospital team members continue to be tested when they experience symptoms or close contact, our staff numbers are a reflection of what is happening in the larger community of London, and that reflects Dr. Summers' comments just a few moments ago. While we were happy to see it is slightly down today at 195 team members, we are also mindful of the fact that with restrictions lifting in our community, we are likely to see a rise in cases, both in patients and in our staff. I would like to remind everyone that we recognize restrictions are lifting, COVID is still in our community. I worked this past weekend in one of our emergency departments, both Saturday and Sunday, and I can tell you firsthand that we continue to see people that are very ill with COVID and require admission to hospital. Please continue to exercise caution and follow public health guidelines, get vaccinated, including the third dose or booster, physical distance, mask, and practice proper hand hygiene. I look forward to your questions.
Thank you very much, Dr. Dukelow, Dr. Summers, and Mayor Holder for your opening statements this morning. We'll get to the questions, but I will make a note to the media. Certainly, if you do have any questions this afternoon, please be sure to get those in right away. We only have a few, so I'd welcome you to get your questions in as soon as possible. We'll start here with the first one from Jane Sims at the London Free Press. It is for you, Dr. Summers. Jane has a two-part question here. Dr. Summers, Jane would like to ask some more questions about the BA2 variant. With hospitalizations and deaths down, she's wondering if A, it's taking over as the predominant form of the disease, and B, is it a milder form of the Omicron variant? Are people getting sick, or is there just more immunity in the community?
Thank you for that question, Jane. The BA2 subvariant is certainly increasing in prevalence and in proportion in Middlesex-London and across the province. It's not yet the majority strain. It's likely between 20 and 30% of all COVID cases are BA2 at this point, but it will become the predominant strain in time. It is more transmissible than the previous Omicron strains. It does not appear to cause more severe illness. Whether or not it's mild or not remains still under investigation from my assessment. The real risk of BA2 is its increased transmissibility. As we are seeing it transmit through the community, we're also seeing reinfection amongst people that had previously had COVID. However, I think that's still likely amongst people that had non-Omicron strains. We're still learning a lot more about BA2. It will impact to a small degree, I think, how the pandemic trends. It will likely make this wave a little bit higher than it would have been if not for that BA2 variant. So again, something to be mindful of. I wouldn't categorize it as having the same impact as Omicron did upon its arrival. This is essentially a subvariant of Omicron, so there's certainly some changes, but it's not as dramatic as having a brand new variant arrive on the scene. We certainly do have more immunity in our community. Our population immunity from previous infection and from vaccination, particularly boosters, is what will make this wave less impactful than the others. That in and of itself is going to be the biggest difference. But as Dr. Dukelow mentioned, the severity of BA2 for somebody that is medically vulnerable or unimmunized and unexposed can be quite severe. COVID remains a very, very serious infection, particularly amongst those that have no immunity because they're unvaccinated. So and older. So we'll keep an eye on that. But yeah, BA2 will be the predominant strain within the next few months for sure.
Sorry, I was on mute there. Thank you for that response, Dr. Summers. We do have another question here from Jane Sims with the London Free Press, and it is for you. Dr. Summers, how many organizations have been in touch with the health unit seeking guidance on masking policies, and what is the advice?
Thanks for that question, Jane. I wouldn't be able to give you a number that have been in touch with us. We've certainly liaised through a number of our different networks with long-term care home partners, with post-secondary institutions, businesses, municipalities, talked to many about what to do with masking right now. And our advice continues to be that we recommend masking in indoor environments given the prevalence of COVID-19 in the community. It's a low impact, affordable intervention for many. The decision for organizations is one that relies on the expertise and the risk-benefit analysis of those organizations. Our guidance to them and our advice to them is for organizations to consider the tools that they have available to them to increase masking relative to the risk in their setting and considering the risks and benefits of requiring masks. It's one question to ask, should we mask or not? It's another question entirely to ask, should we mandate masks or not? They are two different questions. With regards to masking, generally speaking, certainly my recommendation is to continue to mask because the risk of COVID is out there. And for me, on an individual level, I continue to mask. I think that it helps me reduce my risk, and it's not really a problem for me to mask. For organizations, it's an additional risk-benefit analysis for them to consider.
Thank you for that response, Dr. Summers. Final question here in our question forum this afternoon. It comes to us from Nikita Chugg. Apologies, Nikita, if I have not pronounced that correctly. And Nikita is from the Western Gazette. I believe this question is for you, Dr. Summers, so we'll start with you. And I'm not sure if you have the exact answer, but we'll start with that and go from there. Nikita from the Western Gazette would like to know, McMaster and Ryerson University announced recently that they will be pausing on the vaccine and mask mandate on May 1. And if Middlesex-London Health Unit will be advising Western and Fanshawe to do the same.
Thanks for that question, Nikita. We've certainly been in conversations with our post-secondary partners throughout this pandemic and in recent times about what type of precautions they can consider to reduce the risk of COVID-19 transmission on campus. And we'll continue to have those conversations around the decisions on vaccination and masking. As I mentioned, it's two different questions, one around the ongoing recommendations for masks, the other around whether or not mandates are required. And each organization has to consider the risks and benefits relative to their population and the vulnerabilities of their population as to whether or not they want to require masks ongoing or not. I will note that this is the type of decision that will require reassessment month by month. We anticipate that as spring comes, and it's certainly not here today, but as it does come, we will see people spending more time outdoors, and COVID has continuously demonstrated that it does have some degree of seasonality. It will reduce in the community as the weather gets better, which is why reassessing this through April and into May is very reasonable. I do anticipate that we will see post-secondary institutions across the province look at adjusting their requirements as the summer and spring unfold. But again, it's up to those institutions to unpack the risks and benefits of maintaining these requirements in light of the risks that they see amongst their population.
Thank you very much, Dr. Summers, for that response. That was the final question in our queue this afternoon. So that will conclude our virtual media briefing. Dr. Summers, Dr. Dukelow, and Mayor Holder, thank you very much for joining us. Thanks to the media and for the viewers tuning in as well. We will be back to join you on Monday, April 4th. So until then, have a great week. Thank you.